right, let's see who's up next. A dire wolf. Ooh, interesting. All right. Hi there. My name is Dr. Olive. I'll be taking care of you today, okay? Now, what seems to be the problem? What brings you to the creature clinic today? A toothache? Oh, you poor dear. Okay, yeah, absolutely. Let's take a look at it, okay? How long has this been bothering you? Oh, I'm so sorry. Did you eat anything strange recently that might have caused this? Okay, anything else unusual? Okay, sure. Let me just pop on a pair of gloves here, and then we'll take a look, okay? We'll see what might be causing this toothache of yours. Alrighty, let me just get out my little tools here. Got just a few little tools here that are going to help me look around inside your mouth, alright? Alright, open nice and wide for me, okay? Oh my, okay. Yeah, there's definitely some inflammation going on in there, isn't there? You know, before I start poking around, I think we're going to use a little bit of a numbing gel, if that's okay with you. Okay, yeah, no, it should be just fine. Here, I've got just a little bit of a lidocaine gel. It's just a topical treatment. I'll just brush it onto your gums, and it will help to calm them down a little bit before I go looking for the issue. Okay, perfect. Here. Just pop that open here. I'm just going to put this in here. There we go. Don't need very much. This has a little bit of a minty taste to it, but it shouldn't be unpleasant, okay? Alright, now just open nice and wide for me. Just gonna come and just... There we go. Just nice and gentle. Yeah, it definitely looks like there's some irritation, especially over on this side. Is that where the pain is? Okay, well, we'll look around, okay? There. Now that works pretty quickly. How are your gums feeling? Okay, well, I'm gonna get started. I just want to get you out of pain as quick as possible. But if anything feels too painful, you let me know and I'll stop, okay? Alright, I'm just gonna come in here and just start taking a look around, okay? Yeah, definitely very inflamed. Is that hurting at all? Okay, good. That gel is doing its thing. Oh, I think I see what the problem might be right over here. Yeah, looks like there's a little sliver of something stuck in one of your teeth back here. Maybe a piece of bone or something? Ah, they have very fragile bones. I can see why that might have split if you were eating one of those earlier. Let me get my forceps here, okay? We're just gonna see if we can just remove this little thing, alright? It's okay. They're not sharp or anything. I'm just gonna do my best to kind of see if we can get this out of there for you. It is really stuck in there, isn't it? I think I almost got it. Just one more second. There we go. That would definitely cause a toothache. Yeah, I think so. Alright, here, let me just use this little cotton pad in here, okay? I'm just gonna kind of clean up in there a little bit for you. But that should take care of your pain, I think. Good, good. I'm glad you're already feeling a little bit better. Now the gel should wear off in about an hour or so. If you're still feeling a whole lot of pain, you come and see me, okay? It might be a little bit sore, just, since we just took that out, but it shouldn't be any more than that. If it's any worse than just a little soreness, you come back and I'll take care of you, okay? All right, well, I'm glad that you came in. I'm glad that we got you taken care of. Bye now. See you next time. Let's see who's next. Ooh, a Selkie. Interesting. Okay. All right. Hi there. My name is Dr. Olive. I'll be taking care of you at the creature clinic today, okay? Now, what seems to be the problem? Dry skin. Ooh, that is not good for a Selkie, is it? No, certainly not. Has that been hurting your transformations at all? Making it more difficult to pass between a seal and a human? Yeah, I bet. Okay, well, I think we'll start with a skin examination then, okay? So I can take a look at what the issue might be. Okay. I'm gonna just grab my little light here, okay? I'm gonna start out just using my hands and kind of pressing on your face. If anything causes discomfort or pain, let me know, alright? Okay, here we go. Just hold nice and still for me. I'm just gonna be looking around your skin here. Just doing a visual inspection and a touch inspection. I can definitely see some dryness, yeah. Have you been in any oceans that are particularly more salty than what you're used to? Because the saline content of the water can certainly affect skin dryness and irritation. Oh, I see. Okay. That might be part of what the issue is here. Yeah. Well, maybe we should avoid that type of ocean, okay? Or at least if you're going to be in an area that has very high salinity, just make sure that you're also taking time to sort of rinse off in lower salinity water, okay? Yeah. No, that should, hopefully that will take care of it. But if you would like, I do have a very nice prescription strength moisturizer that we can put on you for today, okay? All right, here. I'm going to actually first start out just using a gentle cleanser to see if there's any sort of salt on your skin. We'll take care of that, okay? Here, just got a little bit of a moisturizer here, or a cleanser first. Start off with this. I'm just going to wipe this onto your face, all right? Okay, here we go. Just brush that off. We'll apply this to your face for now, and if it seems to help, then I will send you with a prescription to get this moisturizer. Then you can use it wherever you need to, okay? Really as much as you need to. It's not going to hurt you to like lather it on, but I would say probably about twice a day would be a good amount of time to use it. Okay, here we go. Looking nice and clean now. Now I've got this lovely moisturizer. This is called Ocean Depths Moisturizer. It's made with some wonderful ingredients right from the sea, so it shouldn't react negatively at all with any sort of anything that you're used to, I guess. I'm just going to use another cotton pad here. You can see it's very like, it's kind of a spongy consistency. Wonderful for the skin. Here we go. Alright, so I'm just going to get some of this right on the skin, okay? There we go. It's quite thick, isn't it? It feels a little funny going on, but this will really help to take care of that dryness, okay? Alrighty. There. How is that feeling? Good, good. I'm glad to hear it. Alright. There, got that mostly rubbed in now. Good. Now, does that feel like it's making a difference on that dryness? It's definitely looking like it's making a difference already. That is wonderful. Alright, well, why don't you try that out for today, okay? I'm just going to send you with this one, alright? That'll be a good amount to get you started. If it doesn't fix the problem in a few days, then make sure you come back and we'll try something else, okay? Alrighty, so here you are. Do you have a great day, okay? I'll see you next time. Alright, let's see. Ooh, a Gorgon. Uh-oh, where are my goggles? Alright. Hello, it's wonderful to meet you. My name is Dr. Olive. I'll be taking care of you today, alright? Now, what seems to be the problem, your Gorgonness? Something in your eye that's irritating it. Okay, yeah. Is it dry, itchy? Have you noticed like watering, redness? Interesting. Okay. Have you been anywhere recently where you might have gotten like sand in your eye or something like that? I see. Okay, well, let me get my light here, okay? We're just going to start out with a quick visual inspection with my light here, all right? I'll see if I can see what the problem is. Now, which eye is it? This one. Okay. All right. Well, I'm just going to have you just look right at my nose first, okay? I'm just going to take my light in here. Just see if I can see anything, all right? Just keep looking at my nose there. Don't worry about the light. Just seeing what can be seen. Yeah, I'm not seeing anything right away, but doesn't mean there's not something up there. Why don't you look up for me, okay? Just look up, look up for me as I'm looking around here. Alright, now look over to this side, please. Look to the right. Look to the right, look to the right. Okay. Now look to the left, alright? Look to the left for me. Okay, and now look down, please. Why don't you just look down for me here? Okay, now I would like you to try to focus on this light. I'm going to move it around. Try to just move your eyes and follow it around and tell me if that causes pain, okay? I'm just going to move this around here. Just do the best you can to follow that light. That's causing some discomfort. Okay, alright. Not to worry, we won't do that anymore. I think I'm going to get a little cotton swab and we'll put just some very gentle saline solution and we'll see if we can take a look around, okay? Just 1 second. Alright, let me see where are those. There we go. Okay. Just a simple solution here. Alrighty. Sorry, these goggles are obviously necessary for my protection, but it is a little difficult to actually see in them. There we go. This is just a very gentle solution. It won't cause any sort of stinging or irritation or anything like that, okay? I'm going to go ahead and pop on some gloves here. If I can see my gloves, there we go. And we'll see if we can take care of this for you. Alrighty. There we go. There we are. Alrighty. Now I'm just going to try to lift up your eyelid a little bit, and I'm just going to use this very, very, very gently. See if I can see what's going on in there, okay? Alright, go ahead and look down for me again, please. Just going to come and just... I think I do see a little bit of a sand, or a little rock, or like a little piece of quartz or something in your eyes here. Way up at the top. Alright, use a little more of that solution. There we go. Alright, now keep looking down for me, okay? I'm just gonna do my best to get this up there. There. Okay. I think I got it. Alright, give me some blinks. Blink, 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 blink. How does that feel? Oh, good. I'm so glad. I think that was the problem. Probably just should maybe spend a little less time on the beach. Or at least, maybe wear some protective glasses or something of your own, alright? Okay, well, I'm glad that I could help. I'll see you next time, okay? Alright, bye-bye now. A unicorn, oh my. Alright. Hi there. My name is Dr. Olive. I'll be taking care of you. What seems to be the problem today? I thought unicorns had pretty good healing abilities. A crack? Oh my goodness. Yes, I can see right on the front of the horn here. Wow, I have never heard of that happening before. What caused a crack in your horn, my dear? I see. That is very powerful dark magic. Oh, yes. So this seems like it's less of a physical injury and more of something that maybe needs to heal your aura a little bit. Yeah, I think if we take care of your aura, then you should be able to heal that on your own, okay? Yes, battling a shade can be quite traumatic, especially for an aura that is as beautiful and pure as a unicorn's. So let me see about getting that fixed for you, okay? Now, of course, you can go to an aura healer and they can help you as well, but I've got a few things here that we could use to help you out, okay? I'm going to start with this one. This is an aura healing potion, okay? You can see it's just got some beautiful flowing magic in there. And the blue is a very calming, soothing color that should help to rid your aura of that awful negativity from the shade, alright? So we're just going to take this and put a little bit on a cotton round here, a nice clean one. And I'm just going to kind of brush this very, very gently onto the horn, okay? Is that all right? Okay. If this causes any sort of pain, please let me know and I will stop and we'll think of something else. Okay, here, I'm just going to take this and just brush that onto the horn there. Is that causing any sort of pain? Any discomfort? Okay, sure. I'm sure it's a little bit sore, but as long as it's not causing you any crazy amount of pain, then hopefully this will be able to help a little bit, okay? Yeah, it definitely looks like there's some dark energy seeping out already. That's very good. That's a good sign. Good sign. Oh, good. I'm glad it's already starting to feel a little bit better there. Good, 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 good. You know what? Let me get out a Pegasus feather too, okay? Here we are. Now, as I'm sure you know, your cousin, the Pegasus, is also a very pure, clean, free spirit. And so their feathers have inherent aura healing abilities. So I'm just going to brush this around your aura, okay? Just sort of pass it in and out of your auric field around you, and hopefully that will help to purify it a little bit too, okay? Alright, so I'm just going to take this and just brush it around here. Definitely up around the horn. Good, good, and down. Along here. Good. Good, 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 good. Good, good, good. There. Well, it's already making your aura look a little bit brighter. Are you feeling a little better already? Wonderful. Good. I'm glad to hear it. These are quite powerful. Now, I think also just so we can make sure that your aura has its best chance at healing, I'm going to prescribe you some aura crystals, okay? Here. Have you ever had to take these before? Okay, well, it's very, very simple. They're just these little milky white crystals. Well, they have a little bit of sparkle to them too, I guess. See, they're just little crystals about that big, and they actually will just kind of dissolve in your mouth. It's almost like a little sugar cube. So I want you to just take one of these once per day and just hold it in your mouth until it dissolves, and that should help to clear any sort of auric interference too, alright? Now this has 1, 2, 3, 4, 5, 6 crystals in it. And I want you to just take one per day until they're gone, okay? So for the next 6 days. If you are still unable to heal this crack in your horn by then, please come back and we will try something else. But I would guess that once your aura is feeling better, that your healing abilities will kick in and this will be not a problem. Alright, well, there you are. Best of luck. I'll see you next time, alright? Alright, bye-bye. Oh no, a dragon could be their problem. Hello there. It is an honor to meet you. My name is Dr. Olive. I'll be taking care of you. What brings a dragon to the creature clinic today? How can I help? Scale shedding. Don't dragons normally shed their scales? What makes you think that this is unusual? Oh, I see. Yes, not having them regrow as quickly as you're used to. No, that's not good at all. Okay. When did this start exactly? Okay, I see. Oh, it's all right. It's going to be all right. We'll figure out what's wrong, okay? I bet that that's a little bit scary, not having something that is such a powerful defense that you've come to rely on, to have exposed parts of your skin. I'm really sorry about that. We'll make sure that we take care of it as quickly as we can, okay? All right, is it sort of all over, or have you noticed the shedding without the regrowth more in one particular area than others? Okay, all right, yeah, let me just, I'm going to take my light here and just kind of take a look, okay, and see what we can see. There we go. All right, well, I'm not seeing any sort of discoloration or cracking. They feel nice and hard. Of course, I would need to do other tests to make sure, but it doesn't seem like they're lacking in hardness or anything like that. I don't see any sort of fungi or an infection. And this skin here, is that feeling more sensitive than normal? Okay. Well, okay. I think here's what we're going to do today. I am going to, with your permission, take a sample of the scales that are shedding, okay? I won't take any more, but it looks like there are a few that are ready to be shed, okay? So I'm going to take those and I will get them to my alchemist and he can run some tests on it and see what exactly is going on, okay? And for now, I will give you some scale growth serum on the parts of skin that are exposed, all right? It's just a very simple serum. It's also made by our in-house alchemist, and that should help the regrowth process go a little faster. And then once we get our results back from the alchemist's tests, I'll have you come back in and we'll take care of it, okay? All right, not to worry. We'll get this figured out, okay? I promise we will work on it until we find an answer. Okay, here, I'm just gonna got a little jar here. This is my sample jar, okay? Here we go. Now, I promise I will be very, very gentle. I won't take any that are, like I said, not ready to come off, okay? Just gonna I'm not seeing any sort of discoloration. Very strong. It's not breaking or anything like that. Interesting. Well, like I said, I will send them to my alchemist, okay? We'll see what he thinks, alright? Is it alright if I take one or two more? Okay. We can just make sure that we get enough data from these. There we go. Well, it could be a magical energy that's causing it, of course. It could also just be something strange that you ate, something like that. Have you eaten anything unusual or picked up any gold that was cursed for your hoard or anything like that that you know of? Okay, well, my alchemist will test for all of that, okay? Yeah, they look perfectly healthy. Okay. Okay. Let's put those in our little jar here. Maybe take one more just to be sure he's got enough to run some tests and some spells and things, okay? We'll get it figured out. Anything else that might be unusual, like where you went somewhere to a different region than normal? Okay. Well, I will have him take a look, okay? I'll make sure that he runs some very extensive testing so we can figure out what might be causing this. But as I said, for now, we're just going to use some of this. This is my scale growth serum, okay? This is a wonderful tool for all kinds of different reptiles and scaly creatures. I'm just going to use this and just put a little bit onto the skin underneath where the scales are not growing back. And it should help them grow quite a bit quicker. I also use this when dragons are getting very, 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 very old. And then sometimes their regeneration is, a little slower. But you are still in perfect fighting condition. You look like you could just incinerate a whole army if you wanted to. All right, let me get a... There we go. Just a little cotton round here. I'll just put some of this. There we go. Just gonna get some of this on here for you. There. Okay. Now I'll be very, very gentle. All right. It shouldn't cause irritation. In fact, it will actually probably feel rather soothing. But if it does cause any sort of irritation or pain, let me know right away, okay? Alrighty, here we go. There. Does that feel okay? Good. Alright, just make sure that is nice and saturated in there. And that should be enough to at least get that growth started again. Now, if that doesn't work, then that's an indication that this is some very powerful magic, but it should work. Most likely, it's just maybe a change in the environment. Sometimes if a forest has been cut down more than it's used to or something like that, the forest can get a little angry, and that energy can affect creatures that call it home. So, we'll see, okay? Hopefully it is something that will right itself on time, but if it does not, I promise you I will keep trying things until we figure this out, okay? Okay, I'm glad that you came in today. And whatever the problem is, we'll take care of it together, all right? All right, well, then I will have the front office send you an owl when it is time, once the test results are back. We can schedule a time for you to come in and talk about them, okay? Okay, wonderful. Well, until then, I'll see you next time. All right. A bugbear. Oh, my. All right. Hello there. My name is Dr. Olive What brings a bugbear to the creature clinic today? How can I help you? Your ears have been hurting, huh? Well, that's not good at all, is it? No, I'm sure that that's been quite irritating, especially with hunting and all of those kinds of things. You certainly rely on your ears. Okay, well, has there been anything that might have caused it, do you think? Any sort of very, very loud noises, or maybe getting something in your ears? No? Okay. Not to worry. I will, let's just start out. We'll take a look and we'll see what's going on, okay? Alright, here. I'm just gonna grab my little light here, okay? I'm just gonna come over to this ear first. Just see what we can see here. Does that cause any pain when I press there? Okay, yeah, definitely some irritation around here. Not seeing any sort of abrasions or anything, so that's very good. It's quite a bit of wax buildup. That honestly might be what the problem is. Not seeing anything else. Okay, maybe we'll start with that then. Yeah. Okay, I'm gonna go ahead and check this ear too, alright? I didn't see any sort of scrapes or abrasions, injuries. There is some redness and tenderness, but there's also quite a lot of wax buildup, so that might be the problem. But I'll take a look in this ear too, okay? Just to make sure that there isn't anything over here. Alright, so just hold nice and still for me. Okay. Any extra discomfort or pain over here as opposed to on that side? Okay. Okay. Not seeing sort of injuries or weird substances. Okay. Alright. I think what I would like to do is use a little bit of an ear drop solution, okay? It's just going to go into each ear, just one little drop on this side, one little drop on this side, and it will help to break up that wax, alright? And then I've got some little tools here that we'll use to get rid of that wax for you. How does that sound? Okay, good. There we go. Just a little bit of a dropper here. Now when I put this in, it might kind of tingle. You might feel some bubbling, hear some bubbling, you know, but if it causes any sort of pain, please let me know. Okay. There we go. Just a simple solution like that. Just put one little drop in each ear. Alright. So you come over here. Just a little. There we go. Alright, and then one little drop over here. There we go. Hearing that bubbling already. Okay, good. Good, that means that it's working. Alrighty. Take out my little tools here. I think we'll start with this little guy right here. It's almost a little bit of a spring. It's going to go in there. I'll just very, very gently twist it into the earwax. It won't actually touch your ear all that much, mostly just the wax, and then we'll be able to extract some of it, okay? Alright, over here. Oh yeah, definitely. Okay, I'm just gonna press right here. Okay. Yep. Alrighty. Ugh. feeling any better? Can you hear me any better? Well, good. Let's take a look at the side then, shall we? Alrighty, let me just come on over here. Alright, I'm gonna press right here again. Here we go. There we are. Ugh, that's quite a lot on that one too. Well, there we go. Alright, that was quite a lot. I think that is probably what the problem was. Now, your ears might still be a little bit tender just for the next day because I was, getting stuff out of there. But if the pain doesn't clear up in a day, then come back and we'll take a closer look. But I'm fairly certain that that was probably what the problem was. All right. Well, thanks for coming to the creature clinic. I'll see you next time. A Yeti. Oh, okay. Hello there. My name is Olive. What brings a Yeti to the creature clinic today? How can I help you? Itchy, irritated skin, huh? Okay. Is there one particular area where you're experiencing this, or just kind of all over under the fur? I see. Okay, well, let me take a quick look then, alright? We'll see if we can figure out what might be the problem. I'm just going to use... I've got a little brush here, okay? This is just a nice, fine comb that will help me comb through some of your fur and take a nice quick look, okay? Alright. Here we go. We'll start just over here if that's alright with you. I see. Well, my fluffy friend, it looks like you might have some fleas. Oh, it's nothing to be ashamed of. It's all right. Fleas are quite precocious little creatures. Even up in the colder climates where you live, there's a special kind of magical ice flea that actually thrives in the colder climates. I'm trying to get the Care of Magical Creatures Bureau to actually distribute some information to the Yeti population about them, because I feel like a lot of people think that just because they're way up in the mountains means they don't have to worry about fleas, but it's still very important to do your preventative care to make sure that we don't get any. Well, not to worry. They are pesky little buggers, but they are honestly pretty easy to take care of when you have an alchemist on staff. I have a very powerful ice flea treatment that will clear them up very quickly, okay? Now, how do you feel about baths? Okay, that's all right. We'll start with just a topical treatment. You are going to need to rinse it off in about 24 hours, okay? Yeah, I'm afraid there's not one that doesn't require some sort of rinsing, but we won't do the whole flea bath. We'll start with the treatment and see if that clears it up. If it doesn't, then unfortunately we are going to have to resort to a bath. But we'll try the less submersive way first, okay? Alrighty. Yeah, definitely seeing some little buggers in here and some eggs. When did this itchiness start? Oh, it's been going on for quite a while. I know that coming to the doctor can be a little bit scary sometimes. It's okay. I understand. We're here to help you, but I know when you're not feeling your best, or when you don't know what's going on, sometimes it can be scary, especially if you don't think that a doctor is going to understand. But here at the Creature Clinic, we're here to help, okay? Okay, I'm glad that you did come in today. I'm very glad that we can get this taken care of for you, alrighty? Okay. Yeah, alright. let's get that treatment going. Here. It's just a little bit of a liquid in here. See, it's got fipronil, which is a very, very powerful pesticide that will help to take care of ice fleas, and then also some magical ingredients from our alchemist, just to make sure that they stay away. This is an eradicator, but also a little bit preventative too. So we'll just use a little bit of this, alright? Now, where did you say the itching was mostly localized? Right over there where I was? Okay. Well, then I will put a few drops on here. Now, I know some Yetis partake in self-grooming or in grooming each other. Or does that happen to be the case? Okay, just make sure that you and nobody else grooms you in the next 24 hours, okay? I wouldn't want you to ingest any of this. Yeah, it is, I mean, it won't kill you per se, but it could give you a tummy ache, and I don't want that. Yetis with tummy aches, not a good idea. So I'm just going to take this and just put a few little drops onto your fur, and then we'll brush it in, okay? And it will spread. The nice thing about this is that also, if it infects one flea, it doesn't kill them right away. It gives a little bit of time so that that flea can then infect other fleas as well. So it's quite effective. All right, just gonna put in a couple little drops. There we go. Good, 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 good. And then I'm just going to brush that in a little bit more, okay? And then we'll really get that working. Good. I might also want to put some on the other side, on the other arm as well, okay? Just so we can make sure that it spreads out, takes care of this pesky problem as quickly as possible. Okay, good, good, good. There we go. Just kind of get that going. There. Wonderful. Okay. Now we'll get a few other drops. There we go. There we are. Just going to put a few over here too. There we go. And then, same thing, we'll brush those in, okay? Just work it into the fur and a little bit onto the skin. It won't cause any sort of irritation. It might just feel a little bit oily, kind of, the consistency of it. But it shouldn't hurt you at all, okay? Any sort of discomfort or burning or anything like that, you send an owl and let me know, okay? Okay, but it should be fine. Within 24 hours, they should be all gone. And then I would take a rinse off. All right. Okay. There we go. Excellent. Just get that nice and worked in there for you. Wonderful. All right. Well, hopefully that takes care of the problem for you. If, like I said, in the next 24 hours you're still experiencing more symptoms, please come let me know. But after you take that bath, rinse off, you shouldn't have any more itchiness, okay? All right, wonderful. Well, I'm very glad that you came in today. I know coming to the doctor can be a little bit scary, but if there's something wrong, please don't hesitate to come in. Even if it turns out to be nothing, at least you have the peace of mind of knowing that you had it taken care of if it had been something bad, okay? Okay, well, it was wonderful to meet you. I'll see you next time. Let's see. Oh my, okay. Hi there. It is wonderful to meet you. My name is Dr. Olive. I'll be taking care of you today. Now, what brings a Banshee into the creature clinic? How can I help you? A sore throat, oh my. Well, that's no good at all, is it? I'm sure that makes your wailing very, very painful. Yeah, no good to have any sort of sicknesses or ailments. It's going to mess with such a powerful job as to, beckoning in death and things like that. It's very, very important. All right, let's take a quick look, okay? I'm gonna use my light here and just see if I can get a look inside. All right, so open your mouth for me, please. Thank you. Yeah, definitely some irritation, especially around the tonsils back there. Have you been particularly busy as of late, or was there one particularly sad, mournful funeral that you had to attend? I see. This might just be a case of overworking yourself a little bit. I know. It always seems like there is so much to do, and there's never enough banshees in the world to do it. But if you don't take care of yourself and take a rest, well, then maybe your throat is going to decide for you when you need to take a rest. I know. Easier said than done. I am someone who also doesn't do very well at taking time off of work, but it is so important to give our bodies and our souls the rest that they need. Otherwise, something like this might happen. So let's see if we can get you some relief, okay? Here, we're gonna start with this one today. This is a throat spray. It will help to just kind of numb the throat a little bit. It also has peppermint in it. Now, peppermint has a natural supply of menthol, which is something that can help to soothe sore throats. It's very, very good at that. And of course, it has some other ingredients from our on-site alchemist too, okay? So I'm just gonna take this and just give a spray. I'm gonna try to get it as down into your throat as possible. I know that can be a little bit uncomfortable. Try not to spit it out, okay? Just do your best and try to get this into your throat and all the way down to the tonsils so that we can numb them, all right? Okay, so open your mouth again for me. We're just gonna give a little... Well done. Good. One time I gave this to a dragon and their gag reflex made them actually spit up fire on me. It was not a good day. But you did a great job there. I'm going to do one more spray, okay? Just to make sure. All right, 1, 2, 3. Good job. Thank you for not spitting on me. I appreciate that. All right, wonderful. Well, that should work pretty quickly. You can give me some swallows, all right? There you go, good. Just swallow that down. Do you mind if I just feel around the outside of your neck here and see what we got going on? Yeah, definitely some irritation in there, huh? Inflamed. Okay. I think I'm also going to prescribe some Styx lozenges. Have you ever had Styx lozenges before? Okay, I think they're going to be really, really helpful. These are throat lozenges made from, well, quite a few things, but the main ingredient is essence from the river Styx. They are wonderful for banshees and wraiths and, specters, anything like that. So this should really help to soothe any sort of soreness that you're feeling, okay? So I want you to start out just using 1 or 2 of these per day. If you're having really, really bad pain, you can maybe go up to 3 per day. All right, 1 sort of morning, midday, and then at night. Hopefully the soreness will clear up in a day or 2 with taking these, but you can take them as needed, okay, up to those 3 times a day until they run out. There's quite a few in here, so you should be good for a few days. But more than these, what I'm going to prescribe to you is some rest, okay? Let the world of the dead turn without you for a little while. Let the mortals live without your wailing and your warning for just a day or two. I think that's really, really going to help. Everyone needs some time to rest. Everyone needs time to take care of themselves. Even someone who has such an important job as you. Are there other Banshee brethren that you could kind of contact to help pick up the slack a little bit if you took a day off? Okay. I know that you are rather solitary creatures. Perfectly understandable. But this is a time when there is strength in numbers. So don't hesitate to reach out to people who can help you, okay? So that you can take care of yourself. All right, well, here you are. There are your Styx lozenges. I hope that those help to take care of any sort of pain. But please, please, please take a day or two of rest without any wailing, okay? I think that's going to be the very, very best bet. All right. Well, I'm glad that you came in today. I hope that those solve any sort of issues that you're having. If it still is persisting after about 3 days or so, come back in and we'll try something stronger. But those Styx lozenges are usually very, very effective, okay? All right. Well, thank you so much for coming into the Creature Clinic. I'll see you next time. All right. Oh, another gelatinous